Okay, everybody, coming to you live here from Coronavirus Central. Look, I'm having a little fun with that title, but the reality is that we need to be vigilant right now and know the facts. Facts are always important. There's a lot of information out there now, a lot of things happening. If you're a sports fan like myself, a lot of athletic events in the United States have been canceled. Globally, athletic events have been canceled. Our university level, university events are all done. Like at my university, LaSalle University in Philadelphia, we have no spring activities going on anymore in terms of NCAA sports. It's over. So there's a new reality, and we have to adapt to it. I urge everybody to listen to your leaders and follow what they tell you to do. That's the best case because they're the ones who are in charge. And even if they may act, in your view, irrationally, at some points we just have to adapt and do what we're told to do. It's for the better at this point, at least. Let's look at today's update. So I did a couple of things. I added some other countries in here, added some different states in here. I also started to compare today versus yesterday in terms of the prevalence. So good news, we haven't had any change in Italy since the last report. So now I actually put China off the red list because they're so small. Their prevalence is so small right now. It's like less than one person, or basically one person per 100,000 at this point. So it's not even worth mentioning them anymore, which is really nice. I think that's good news. The top countries that we're looking at now are Italy, South Korea, and Norway. I added Norway because I've a graduate student friend who is from Norway, and she is concerned, and rightfully so. So I added Norway in here. But if you look at the change from yesterday to today, it has a lot of decimal places there, no change. So maybe this means that there's some peaking going on here. Iran, all these are all changes per 100,000. The only one where we see any kind of, let's see, the biggest change in a positive direction, I guess Slovenia, it's almost a person difference. So let's look at these prevalence estimates. So we're still looking at about 17 people per 100,000 in Italy. South Korea. Now, South Korea is being lauded for its approach and its ability to test so many people. Testing is important. One of the issues we have is not everybody's being tested. So one could say, and there's a lot of yeah, but people out there who always want to contradict everything that is said because they're afraid or they just want to look like they're intelligent or something. There's a lot of yeah, but people. One would say, well, how do we know that, for instance, the prevalence in the United States, which I have here at 0.5, half a person per 100,000, isn't higher because people aren't getting tested? Okay, that could be. Let's look at that argument. People get tested when they have symptoms. Now, some people are asymptomatic, and that's possible. So those people wouldn't get tested, just like they wouldn't get tested for the flu. You usually don't go to see your healthcare provider unless you're sick. So if you're not sick, you're not going to go to your healthcare provider. So it's possible that we're underestimating every illness, right? So we have no idea when people are asymptomatic. When people become symptomatic, they go in usually at some point when things get really bad to get tested. So we have to rely on people to get tested. We can't go around and just force test everybody. Although there are places where some governments are providing free testing now, state, local governments are providing free testing so that people can get tested if you're scared. So that's an issue. So maybe the prevalence is a lot higher in the U.S. and it's hard to say without testing. But then again, those people who are being tested are the ones who are probably in most need of testing. In terms of mortality, we have 40 deaths in the United States. The majority of those are in, if we look down at our breakdown by state here, 31 out of those 40 deaths are in the state of Washington. And most of those came from a nursing home. Somebody unintentionally, obviously, walked into a nursing home and spread this pathogen, and that's what we had. So understand that this is is a serious condition, but it's not. And again, people will say, well, you have a chance because you want to compare it to the flu. The flu is nothing. This is serious, and you're downplaying it. First of all, I'm not comparing the flu in the severity of personal symptoms to the flu, to this COVID-19, which is coronavirus disease 2019, COVID-19. But I can't help to look at these. These are values for CDC estimates from October 1, 2019 through February 29, 2020. This is how many illnesses we have. We're talking about population prevalence, right? Somewhere between 34 and 49 million flu illnesses. Just make sure you take a moment to dial that in. I mean, what's our population here? It's 329 million, right? So keeping that in mind, we'll go back to this site. Look at that. Over 10% of the population fell ill at some point to the flu. Flu medical visits. So people, see, look at that. As out of these, so many people are going to the doctor. Not everybody's going. Some are. And we have this many hospitalizations, between like up around 500,000 hospitalizations due to the flu, and deaths range from 20 to 52,000. Yesterday I was saying, well, you look at this range, it's odd. Well, it's hard to pinpoint things because we have to look at death certificates and look at the causes of death, the underlying conditions. So it takes a lot of time to pinpoint the exact cause of death. So it's not as easy. So this flu is very serious. And those of you who are worried about the coronavirus, the novel coronavirus as it's called, you should be worried about the flu as well. If you haven't received your flu shot, then you're being hypocritical. Don't be a hypocrite. You get your flu shot. Either we care about health or we don't care about health, and urge others to get it. Let's compare this to the H1N1, because there's a lot of talk about H1N1. So this is what we're having right now, I guess, is the most serious condition we've ever had in the history of the United States, right? Well, let's look at H1N1. So I'll just go ahead and read. This comes from I only use reputable sites. This is from the CDC. So while the monovalent H1N1 PDM09 vaccine was produced, it was not available in large quantities until late November, after the peak of the illness during the second wave had come and gone in the United States. From April 12, 2009 to April 10, 2010, CDC estimated that 60.8 million cases, 60.8 million cases, compare that to what we have now, 274,304 hospitalizations, and 12,469 deaths in the United States occurred due to that disease. CDC estimated that 151 to 575 plus thousand people worldwide died from this pandemic. Okay, so that's interesting. In that condition, majority of deaths were younger than 65. It turns out that people who are older than 60 had antibodies for H1N1 due to an earlier strain. It's really odd. We're seeing now that people are older are dying because this is more of a novel virus that people don't have antibodies for. But see, this should put things in perspective for you, that while this is a serious condition and it must be treated seriously, and it is being treated seriously by our government and governments throughout the world, we're not even worried at all about the flu. We're not canceling games, we're not canceling anything because of the flu. Yet it's killing way more people. I mean, you can't even compare the number of deaths, hospitalizations, the toll on our economy. But there's just no panic. There's no panic. Well, while we're talking about testing, I was looking for some information about this one test for this novel coronavirus. It's called SARS-CoV-2. This is actually what it's called, right? And what I was looking for is the sensitivity and specificity. So sensitivity is the ability to predict the probability of predicting somebody who has the disease, right? So if they have the disease, getting them a positive reading. So that's how we measure the sensitivity and the specificity. If you don't have the disease, you should test negative. These values are usually, hopefully, in their 90s or something like 0.9, right? Or something like that. Well, I didn't like this. This information is not available to us. So how do we know that we can even trust this test if we don't even know what its sensitivity and specificity is? As a consumer, in any time you get tested for anything, these tests have sensitivities and specificities. The higher the sensitivity and specificity, the better. Usually that means they're more invasive. Usually in testing, the frontline test will be one that's a little less sensitive and have maybe a little lower specificity. And then when you go for the follow-up, if you test positive, then you have this testing that's much more sensitive and specific. But I don't like that we don't have any idea about this test. We really don't know how good it is anyway, so because we're not being told. So this is just one of the tests. This is what is this? This is from this laboratory. Yeah. But anyway, so that's information for today. Again, as I urged yesterday, please stay safe. Follow the rules of your governing bodies. I ask you to not panic shop, because that's really hurting people who need the products the most. Be a good citizen. Make sure that the elderly and those with compromised immune systems or underlying health conditions that can be really seriously affected by this coronavirus get what they need. Don't hoard. If you must travel, plan well. I think the airlines are doing their best job possible to make sure that everything is clean and you'll be safe. And they're probably not very full right now, but I wouldn't travel to, and I don't think we can travel to areas that are very highly hit, like say the state of Washington, where there's basically 6 people per 100, well, 5.5 people per 100,000 who are ill with COVID-19. I try to stay away from those areas, but and California, I suppose, California's not, 0.574, it's half a person per 100,000. New York and Massachusetts seem to be worse. I added Texas here too, just so Texas and Florida, so you can get some other popular destinations. But if you feel unsafe traveling, just go with your judgment. All right, well, thank you very much for listening again, and I hope this helps you in some way.